Hello, ma'am. Good day. I am Patricia Andiga Sulga from BSN 12J. So for today, I'll be going to perform the return demonstration in catheterization, specifically in urinary catheterization. Urinary catheters are used to drain your bladder, or this is recommended to those who are a leakage in urine or unable to control when you urinate. So now I will start my demonstration. So first and foremost, you need to check the doctor's order because the procedure to be performed is invasive. Next is wash your hand. This is to deter the spread of microorganisms. Then you need to remove your jewelries. So next is identify the patient and explain the procedure. This is to ensure that the procedure is given to the correct patient and also to gain patient cooperation. So hello ma'am, good day. I'm Patricia Antiga Silga from Davao Doctors College and I will be your student nurse for today. May I know your name, ma'am? Your birth date po?
May 20, 2007.
Tatanaw ko sa wristband, ma'am. Thank you, ma'am. Kung sino gusto itawag na ko sa mga ma'am?
Irish.
Okay. Hello, ma'am Irish. Today, ma'am, I'll be going to insert a catheter. Is that alright?
Yes.
Okay lang si mga ma'am kung mag-Bisaya ta or speak in Tagalog or English. So, karon ma'am, sa pag-insert sa catheter, ma'am, is na ay mga times na magunit ko sa imuha, ma'am. Mga ilang kong permission sa imuha, ma'am. Okay lang, ma'am?
Okay.
Okay, ma'am. So, next is provide privacy by screening or closing the room and position the patient in dorsal recumbent with the knees flexed. This is to protect patient's dignity, and the key to a good urinary catheter is getting them in a good position. So, I already closed the door to protect our patient's dignity. So, next is drape the patient, exposing only the area to be used. This is to reduce the risk of infection. Ma'am, pabend lang ko, ma'am, ha? So, next is apply direct light for visualization of genital area. This is to have a proper lighting. So, this is my flashlight. So, next is open the tray and arrange the equipment accordingly. This is to avoid contamination of sterile items. So, these are our sterile items. First is sterile gloves. We need to put our sterile gloves first to maintain the sterility. So, we have here a betadine for our cotton, and of course, a cotton, a tape, an eye sheet, a catheter, a urine bag, 10cc syringe, a forceps, and a kidney basin. So, Our table is sterile because our items are all sterile. We need to maintain the sterility of our items because we are going to touch the genital part of our patient. So using the sterile forceps, cleanse the area using cotton ball with betadine. So this is our betadine. We will soak our cotton ball. We will cleanse the genital part of our patient in this one is like the perineal flushing. Put the eye sheet to avoid infection. This is our eye sheet. Next is lubricate the catheter for about 1 and 1/2 inches, being careful not to plug the eye of the catheter. So first, we need to check if our balloon will inflate. With the use of our 10 cc syringe, we will check if our balloon will inflate. So assuming that our balloon is inflating. Pick up the catheter for at least 3 inches from the tip of the thumb. Place the thumb and 1 finger of the left or right hand between the labia minora and separate and pull up gently. So, separate the labia minora and pull up and then insert the catheter. Insert the catheter into the meatus for 2 to 3 inches or until urine begins to flow. If a specimen is to be collected, pinch the catheter with the thumb and the finger while placing the specimen container in position. Rest the hand in the pubis area while holding the catheter in place to prevent pulling and pushing of the catheter. Connect the catheter to the urine bag. Inflate the balloon with the use of 10 cc syringe with sterile water. So we will connect our catheter with the urine bag. Then we will inflate our catheter, our balloon, inside the bladder. So assuming that the balloon inside the bladder is inflated. So next is, we will secure the indwelling catheter by taping it to the patient's thigh. Allow some slack of the tubing to accommodate the patient's movement. We're gonna put the tubing with a stat lock on the patient's leg, never under the leg because that can cause a pressure sore. Then we will attach the urine bag into a immovable part of the bed below the level of the patient's waist. So our indwelling catheter, we will attach in our patient's thigh. And the urine bag, So next is place the patient comfortably. Then do the aftercare. And also record the time of procedure done, amount, and color of initial output. So in our documentation, the procedure is done by 9 a.m. Patient tolerated the procedure well, and 10 ml of cloudy amber urine noted, and we will continue the monitoring. That's all. Thank you.